Thank you very much. Cheers, dear colleagues. It's our pleasure to be today on this very important meeting organized by EASL and World Hepatitis Alliance together with WHO. And in my short presentation, I would like to give you some overview regarding the progress towards the HCV elimination in Georgia. Georgia, as you maybe know, it's a small former Soviet Union country located between two seas, Black Sea and the Caspian Sea, with the population 3.7 million. Still, from the macroeconomical point of view, it's a developing country with the 3.6 thousand US dollar per capita and with 2.7% of governmental health expenditure. We have reached some goals of MDG in the infant and under 5 mortality, but still we have twice more than the Western European countries. And also we turned in 2012, 2013 to the universal health coverage. Regarding disease burden on HCV, unfortunately my country is among the highest hepatitis C prevalence countries. Several studies were provided in the country. First one was one of the population-based study in 2000-2002, only in capital city Tbilisi, when we revealed in that time 6.7% of seroprevalence. And in the most affected groups in people who inject drugs, these are 66%, in TB patients 21%, and in MSMs in capital city 7.1%, and on the Black Sea coast city Batumi around 19%. Our baseline currently is the study implemented last year together with the CDC Atlanta, and I'd like from this podium to thank CDC Atlanta for technical and financial support. This first population-based study in the country when the random selected population in all regions of Georgia, and our goal was to investigate about 17,000 population, and the response rate was quite good. 6,300 was interviewed and collected blood from the 6,011 population. And the lab results showed that we have, unfortunately, still high prevalence. This is 7.5 HCV antibodies and 5.3 active infection by RNA positive. It means now the absolute figures we have in the country, and this is the baseline for the elimination process, around 148,000 active infected patients in the country. And by the genotyping distribution, the dominant is the genotype 1, then comes genotype 3, and the genotype 2. This is the prevalence by age and gender, and the infection is concentrated in male population, and particularly in the age group from 30 until 49. These are the data of this last population-based study when was conducted in all regions and the big cities. Here are the results of 6 big cities, and the weighted results of RNA positives shows that the 1/3 of the positive population is concentrated in capital city in Tbilisi. Now, according to these results, we know and we can forecast how many treatment centers we need, how many physicians we need, what kind of resources we need, and 1/3, about 55,000 are in the capital city. As well, in the west part of Georgia, on the Black Sea coast, is most concentrated the infection and affected persons, and accordingly, we know now the exact figures after this study where we have to concentrate our elimination efforts. And as well, this study shows that after the multivariable analysis, that the most risk factors, of course, are the IDU without or with blood transfusion, then comes blood transfusion without IDU history, and then the incarcerated persons without IDU or blood transfusion. Then about 40% are unknown factors, what needs the further discussion and the investigation. This is the process of the strengthening of the elimination process in Georgia, what was strengthened since 2011-2012, when first time by the support of Global Fund was free of charge treatment introduced by PEG and RIBA for the co-infected HIV, HCV co-infected patients. In 2013, the new government has introduced free of charge treatment by PEG and Deriba in prisons, HCV-infected persons, and then 60% discount will give into the civil society for 10,000 patients. And 2014 was like the breakthrough in our HCV progress when the country has announced that in Georgia elimination process is realistic, and this was started the negotiation with US partners, particularly CDC Atlanta and the Gilead company. And during the first national workshops in 2014 they introduced the philosophy of the elimination process in Georgia. In 2015 was signed the Memorandum of Understanding with Gilead, and the Sofosbuvir regime since that time, since May last year, is available in the country for the patients. And on the first stage, these patients was planned as a 5,000, most time in the severe patient with F3, F4 liver damage. In reality, I will show later on that was reached more than 7,000 currently the patients under this treatment. And and in 2015, we have as well the created special technical advisory group, included the most prominent experts, international experts as well, the representatives, CDC, WHO, European, and headquarters as well. And with this technical advisory group, we started drafting the 5-year national strategy. In this year already, last week, we had a third national workshop where we have summarized the results of first year of the elimination and also finalized the draft, the strategy for 5 years, 2016-2020. And hope that during the next session, we will see also Georgia on the WHO website, where the plans already exist. And also in February was introduced by support of Gilead, the Harmony for the treatment. Why is elimination of hepatitis C in Georgia feasible and achievable? There are some, division about this. First of all, this is the high prevalence country. Small country with 3.7 million population, very strong governmental commitments towards the elimination HCV, and for the current government of Georgia, the Universal Health Coverage Program and Hepatitis C elimination program are top political priorities, and we have a very strong governmental commitment for this. Availability of all modern HCV diagnostic and treatment methods in the country, stroke human resources. This was the experience during the HIV, the process in the country, where the Georgia has also the universal access to the antiretroviral drugs, and we have quite a good results on the HIV process. Existence of effective systems for implementation, international and national programs, availability of logistic and control mechanisms within existing national HIV, tuberculosis and hepatitis treatment programs, and adherence to principles of evidence-based medicine for hepatitis C. And currently we have all the guidelines for diagnostic and treatment in HCV. These are some history. The first national workshop, then the signature ceremony when the first phase of hepatitis C elimination project started last year, then launched by the signing of this together with Gilead by the government of Georgia. Second workshop, then we have first results presented during the Glasgow summit by our Minister of Health, Mr. Sergeyenko, has presented all these results. The first technical advisory group meeting last November in Tbilisi, and the results of the first phase, the very short, in short form. Last year we have screened around 175,000 population for HCV with the voluntary or mandatory screenings. Around now 22,000 we have now in the STOP-C, so-called the STOP-C database. Around 17,000 was, diagnosed on HCV RNA positive, and 6,000 by the February 15 was enrolled in the treatment. All these 6,000 patients have been severe patients with F3, F4 liver damage stage. And 3,400 completed for February 15 the treatment. Among them, the results are like this. That's the SVR was reached, the average was 84% around. By genotyping, by genotype first was the 74, genotype 2, 87, and genotype 3, 85. This all was the regime sofosbuvir plus PEG plus ribavirin, according with the genotypes, the guidelines. The next, what we are doing, this is the hepatitis elimination strategy, and the major goal is elimination of HCV by ensuring prevention, diagnostic, and treatment of the disease. And this is drafted, our plan is accordingly by the manual of WHO, how to draft the national plans. And the 4 major goals: raise awareness of viral hepatitis, monitor health sector response, prevent transmission of viral hepatitis, reduce new infection and deaths due to viral hepatitis through expanded screening and treatment. And 7 major directions in our strategy, what was discussed during the TAG meeting on November, and all TAG's recommendations are incorporated in the current finalized, the draft. First of all, this is HCV screening, treatment and care, infection control, and we have strengthened very much in the country, and political commitment of the government looks also very nice in this direction, to strengthen as much as possible the infection control, awareness raising, safe blood, surveillance, laboratory harm reduction. And we are very good cooperating now with the ECHO project from US regarding the consultation, online consultation of the severe cases for treatment. Major targets, of course, all this, the 7 direction has a big framework of monitoring and evaluation, but the major targets are 19, 95, 95 for 2020. This is, I understand that it's a very, very, the big ambitions, but we try to get this. First of all, 90% of people living with HCV are diagnosed for 2020, 95 of those diagnosed are treated, and 95 of those are treated and cured. And this, as we know, the baseline now, according to our population-based study, we have to treat around 148,000 patients, and this is the cascade of HCV here until 2020. These are last week was also the 3rd national workshop on hepatitis C with the participation, most famous, the international experts from different countries and organizations, CDC and WHO, and we are very pleased to, together with them, we have finalized our elimination strategy. And regarding the next step, in this end of this month, we will submit the national strategy to the government. Technical advisory group will be gathered in Tbilisi in Georgia in September, and you are welcome to attend this meeting. And the second phase of elimination program, we are now in the process of transition, because we have enrolled in the first phase all, the severe patients. Now we will start to treat everybody in the country, regardless of the liver damage. And the major challenges during this 1 year and the lessons to learn are, of course, and occurred quite a lot of what we are going to discuss today. And I kindly invite you to attend the Georgian site meeting, 6 p.m., between 6 p.m. and 8 p.m. in the room 7.1 next to hall 6, main plenary room, 6 p.m. to 8 p.m. And all the, topics what I touched now in these 15 minutes, we will discuss more precisely. I'd like to acknowledge to our Ministry of Health, Centers for Disease Control and Prevention, CDC, of course, the Gilead Sciences and World Health Organization for their support to my country. Thank you very much.